Thank you, Rajalashmi, for the great introduction. Good to see you all. And I know that you people are from different parts of India, joining from your own end to become a volunteer. And you have listened to many lectures in these days, especially the introduction to palliative care. And you got the basic idea about what is palliative care, how you are going to involve in this activity. Today, we are going to see the important aspects of palliative care as a volunteer, the involvement of community in the palliative care program. And before going to that, I would like to get some feedback from your side about what you have learned about palliative care and what are the elements in palliative care like that. And if I switch off my video, sometimes due to my health issues, I won't be able to sit properly for a long time. If I please excuse me. Yeah, thank you. Okay, one can just start with what you have learned about palliative care. What is palliative care?
Palliative care is an team approach, sir, which is consisting of the different healthcare professionals, which starts from the point of diagnosing a disorder to the entire continuum of the care. And it's not only limited to the end of life care, but it is to the all the disorders in order to improve the quality of life.
Thank you. Thank you. Anything to be added to this? Everything is included in this, what he has said. And if anyone is willing to add something more, you can add. Otherwise, we'll be going with our presentations and all. I'm just trying to show a model from our side. One of the participants has shared one thought in chat box, like to improve the quality of life. That's exactly what we are just concentrating on, the quality of life of patients and their beneficial, the caregivers or the family members. Yeah, right. Thank you. I'm just trying to present a model before you, because Kerala, most of the time we used to say that like Kerala model palliative care, and just trying to show the model before you. And the main points covered in this sessions are like the what is the community involvement, then the major concept which we use for palliative care activities, the formation of communities in Kerala model. Then what are the roles performed by the volunteers? And these are the main things I'll be sharing. And our Sunanda ma'am will be sharing how you are going to act up after these sessions, all these sections. Okay, thank you. As I said, palliative care is a model, especially Kerala model. One of the famous persons, Dr. Richard, expressed that the hallmark of
your slides are not visible, sir.
Yeah, I'll be sharing. Before that, I'll be giving some introduction. Yeah, thank you. Yeah, the hallmark of palliative care movement in Kerala is. Pardon?
Sir, it was a disturbance. You can continue, sir.
Okay, fine. The hallmark of palliative care movement in Kerala is a participation of the community. Now we are going to see the role of palliative care, the role of community in palliative care system, especially how we are going to involve in these activities. Is it visible now?
Yes, sir, it is.
Yeah,
Can you make it into presentation?
Yes, I will. Yeah. Thank you.
Yes, perfect, sir. Perfect.
Then we are going to see the importance of community. How we are going to define a community? What is community? If anyone is willing to share the information.
Community is the society in which we.
Mr. Srinivasan, you got muted. Can you unmute and speak?
Yeah, sir. Community is the society in which we live in, sir. It comprises of individuals who are living with us, our neighborhood, family, relatives, all that.
Yes, thank you, thank you. Yes, Srinivasan sir, you have said exactly the where we live together as a community, or where we live together with our family members, with our neighbors. That is a community. How we are going to identify the importance, how we are going to identify what is a community, or like that. Especially uh, when we say something about community, that we will say like how we are going to respond to a particular cause or a reason. Based on that particular activity, we may identify that community. Yeah, based on the activity or the response, we will be identifying the community, the importance of community. Before going to see the detailed about the community involvement, we are going to see the evolution of palliative care concept. It has started with the hospice movement, started by Mother Mary Aikenhead, the irisist of charity, and she has established a hospice. That is a one of the that is that was one of the first and foremost hospice in the world. That is situated in Dublin. It has started in 19th century in Europe. Then the slight change in the hospice movement to the palliative care movement, that change has made by had made by Dame Cicely Saunders. She's known as the father of the leader of palliative care movement in all over the world. And she has introduced the concept of total care. You have already seen the what are the elements which we take care in the palliative care activities. Like when we see a patient as a physical, psychological, social and economical, and spiritual. This total care, or the complete care, has introduced by Dame Cicely Saunders, and she has also initiated some hospice movement in the initial days. That is, her hospice is known as St. Christopher's Hospice in London. That was started in 1967. Many of our staff members and many of our volunteers has visited this organization or the hospice and got training from that particular organization. When we come to India, the pioneer of palliative care in India, the official introduction of palliative care has been done by Dr. M.R. Rajagopal. It has started earlier, like 1988, like that. Many of the people has came to India and introduced palliative care in different ways, as a hospice movement or something like that. That was done by Dr. D'Souza, and then it was officially introduced by Dr. M.R. Rajagopal in 1993, while he was the head of the department at Calicut Medical College in anesthesia department. And then that model is called as the Calicut model. Already I have told that it has officially started in 1993 at Calicut as an OPD. Then the community elements or the community movement started in 96 as a link center. I'll be explaining what is a link center later. At Manjeri, there's a part of Kerala. Then there are different movements in Kerala, like based on certain concept. Main concept is NNPC. That also we'll be seeing detailed in another slide. And in this way, the community or the palliative care movement has started and initiated officially and spreaded all over Kerala. Then you have seen, or you may know that the palliative care policy has initiated in Kerala, like the Kerala model does provide feasible, achievable vision of palliative care covering all patients, all settings, and all diets. As a response to a request from Pallium India, the government of Kerala recognized the need and formed a palliative care policy in 2008, and it has revised in 2019. And that particular policy itself expressed that the involvement of community and the role of community in palliative care delivery system. Especially the palliative care policy clearly mentioned the government facility has its own limitations to provide care and all the things. But when the government facility, government system has taken the support of the local NGOs or the local non-governmental organizations, those who are part of palliative care in that community or in that panchayat or in that local area, through that they will be able to give the proper care or quality care to the beneficiaries. Then that particular project or the particular palliative care policy has implemented with the support of the National Health Mission Arogya Keralam project, that has under the leadership of that National Health Mission, that is in the government level palliative care is implementing. Already I have told that it has started in the Calicut Medical College by utilizing the existing infrastructure facility of government hospitals, starting a OPD at that particular hospital. And there they found huge gap between the care and the like care providers and the care receivers. That has been filled by with the support of volunteers. They have identified community volunteers, and they have got sensitized, they got trained, and after the training they will be sent out of the community. Then they will be identifying the needy persons in that community. Then they will be creating a partnership with the patients and their family members. With the support of these community volunteers or trained volunteers, we are just empowering the family in different ways. I have already mentioned that we'll be taking care of the whole parts of all the all elements of patients and beneficiaries. Like we'll be taking care of their physical aspects, and we'll be taking care of their social and economical aspects, then the psychological aspects, and all parts of their life will be covered with the support of this community volunteers. That I'll be showing a video with you and how the community is involving in that particular activity. Here you can see the two models, or the micro model and the macro model. Micro means the individual family, individual beneficiaries of the healthcare element. And the macro is the healthcare providers. We can see a huge gap between these two. If I go to a hospital, I'll be getting the consultation from the hospital. If I not go back to the hospital, the hospital is not aware about myself. They are not following with me. If I am not going back to hospital and reporting, these are my conditions, everything is subsided, and I'm okay with your treatment. But with this system, it is not possible. There we have just implemented the community element, the social capital element, or the meso element. This gap can be filled with the support of that community. When a patient gets care from that particular hospital, the particular volunteer in that group or the volunteer groups, just they will be doing the continuous follow-up with this family, and they will be, the community volunteers will be updating with the care providers. And this shows the importance of community in palliative care system. Now we are going to see the what is community-based palliative care, or the concept of community-based palliative care. Here we can see the community links. That means the community trained people in that community will link the patients with the care providers. And they will be identifying their needs, or they'll be identifying the needy people in that community, or they will be identifying their needs of that particular people, those who are identified. And with the support of this community, the need has been fulfilling. Then through that, they will be energizing the family, energizing the beneficiaries, and this way they will be giving care. That means community-based palliative care is life caring. So they will be taking care of the lives in the community. Like already I have told that the major objective of palliative care, community-based palliative care, is like involvement of and involving different communities for these activities. The community-based palliative care is aimed at creating a network of patients with the support of family members, neighbors, colleagues, friends, to help in reducing the physical, mental, mental means psychological, social, and economical, spiritual stress of the patients and their immediate family, and also creating awareness in the society to total care and compassion. The major objective of involving the community is this, like we'll be creating a network of group, or I have already mentioned that the concept of NNPC. NNPC means neighborhood network in palliative care. That concept will be seeing detail afterwards. The components of community-based palliative care are the community volunteers and the healthcare professionals. Healthcare professional means different team members will be there, like the volunteers will be there, doctors, trained doctors will be there, nurses will be there, trained professional social workers will be there, the physiotherapists will be there, pharmacists will be there. As a team, we'll be approaching the beneficiaries need, or as a team, we'll be taking care of the needs of that particular beneficiaries. This pyramid shows that the importance of the community involvement in palliative care. The professionals has its own role, but the community can take the leadership. The community can give or provide all sort of social support to the needy people. I have already told that we'll be explaining more about neighborhood network in palliative care. We will be seeing three major concepts which we use for our community formation or community-based activities. The neighborhood network in palliative care, the major activity, or we are through this activity, we are just empowering the local community to look after the bedridden patients in their area. We are just identifying the volunteers. Like these are the major steps to identify or the form a community for palliative care. We'll be identifying, or we'll be like identifying certain leaders from that community. With the support of that particular leaders, we will be asked that particular leader to create a platform for us to speak about palliative care, to just make the community aware about palliative care, or to sensitize the community. After that sensitization, or after that awareness program, few of them will come as a volunteer. Like, I would like to spare my time for this activity. I can give some support, or based on my contacts or based on my expertise, I can give some like support system for this activity. Like that, we will be identifying volunteers from. After that identification, we will be asked them to get training in palliative care. Usually, we will be conducting online training program and the offline training program. The offline training program will be in 3 days. like 2 days theory classes, 8 hours, 8 hours, like 16 hours training programs, theory classes. And one day they will be accompanying with our team members to see what is happening in the community and what the volunteers are doing in that community to make changes in the life of other people. After the training program, we will ask them to gather together, and they have their own specific area of activity, like specific area, identified area of their activity. And we will ask them to create or we will ask them to register as a society or a trust in their community, because they, if they are not doing that, they won't get the ownership of, or they won't recognized by the community. For that, we will be asked them to register as a society or a group. Then that group will be identifying, or they will be before identifying the patient, they will be finalizing with their working area. Or sometimes they may choose a village which include 4 to 5 wards of a particular panchayat or particular area, and another will be they'll be adding some other wards from some other panchayat, or they'll be fully concentrating on a in a panchayat. Like we have a model, we are just trying to create a model in different areas, but we have a model like we have identified 2 panchayats for these activities to create based on the Kerala palliative care policy. We have identified 2 major panchayats to start working with as a model palliative care panchayat in their area. For that, we have identified a community for that. As a step already, I have explained what are the steps we followed in that activity. After that, they have particular panchayat is having 20 wards. From each wards, we have the particular volunteer group has identified 5 to 6 volunteers from each ward. Then that is 20, like 110 or like that volunteers. All of them got training, and in that particular ward, they will be identifying the patients, and they will be connecting that particular patients or the beneficiaries with the major or the main groups. That activity is known as like we will be doing a need assessment program in that particular area with the support of volunteers or with the support of trained volunteers. We will be completing that need assessment in their area, and we will ask them to we will be giving a specific format for that, and from with the support of that format, they will be identifying, they'll be doing the need assessment. After that, we'll be doing some sort of screening, and after the screening, we'll be finalizing the those who are like the patients, those who are needed home-based care or the OP based care or the IP based care. And after that, we will be assigning one of our team. We'll be sending our team to that particular area, and they will be visiting the families with the support of that community volunteers. Through this concept, we are just following these steps to form a community for palliative care activities. Already I have told that we will be using different concepts for this formation of communities. Like NNPs is one of the concept, and to through this, we will be developing a cost-effective method for provision of palliative care in our settings. Like we know that when we, or for example, when I have some problems, health issues, if my family want to take me to hospital, but I am living in a hill area, my family is not able to take me to hospital. There we need the support of volunteers or the support of other people. And when we got the support of volunteers, but we won't be able to hire a vehicle for or to take me to the hospital, or hire an ambulance to take me to hospital. But with the support of that particular volunteer group, they will be supporting all these type of transportation facilities. with the support of that particular volunteer group, they will be taking me to the hospital. But there is also some sort of cost in the hospital, but that may take by the community volunteers. Otherwise, when the community volunteers take the palliative care team to my home, that is also a cost effective, or that may reduce my cost about my caring and all the things. And through this, we are just trying to involving of community volunteers or community. We are just trying to create a cost-effective method. That means just reducing the burdens of different costs bear by the family members. The network NNPC methods, there will be trained volunteers network. Then the trained volunteers will be like getting support by the nodal agency or the care providers from different areas, or the particular community volunteers group is act as a palliative care nodal agency in that particular panchayat or particular area. I have told that already. We will be using different concept. The NNPC concept is for a large community, but when we see some sort of small group, we'll be using triple C concept. Triple C concept means compassionate community care. We'll be seeing the concept in detail. This concept we will be using for small communities like residents associations, or the like welfare organizations, or arts and sports club. You may know that you may be familiar with this concept of these organizations, or the pensioners association, senior citizen association. They will be gathering in an area. They will be uh, uh, getting training from our side. They will be giving, or they will be supporting that particular community. Like if for example, for example, the residents association that contains 100 families. We'll be identifying 25 volunteers from that residents association. We'll be giving training to them. And after that training, they will be the 25 identified volunteers, trained volunteers will be providing all sort of support in that for that 100 family members, 100 families. And through this concept, we are just trying to create a culture of caring. Like if I am having some troubles, or if my family is having trouble, or then my neighbors are with me. Yeah, otherwise my all the burdens will be on my family. When the community or the neighbors are involving these activities, my family gets some sort of relief, or some sort of support from other communities or other neighborhood. And based on three major principles like compassion, all people are entitled to be treated with dignity, respect, and equality. We know the meaning of compassion. Then the principle of community. We act as a as a group. We'll be giving care to the group, so with the support of that group, or with the support of a group of volunteers or group of people, we'll be getting assistance in many activities. Then the principle of care. All people are entitled to receive the care they need. A person is a physical, psychological, spiritual, and social being. Each of these areas requires the appropriate care. And based on these concepts, we will be with the support of this concept, we will be concentrating small communities. Another concept which we use for mobilizing students or the youth for palliative care activities, especially this concept is known as sans pain. Sans means without. We are just trying to create a pain-free communities with the support of this student volunteers. The SANS stands for Students Against Needless Suffering and Pain. Based on this concept, we have just initiated a group known as, especially in educational institutions, we have formed a group of student initiative in palliative care. In 2018 or 17, we have submitted a proposal to the Higher Education Department of Kerala, and based on our proposal, the Higher Education Department has declared that all the universities in Kerala must have to collaborate with the palliative care different groups to start palliative care clubs in their respective colleges by using the platform of NSS. NSS means National Service Scheme. It's a central government project, which we get or we are just trying to involve students in different social activities. And through that NSS platform, yeah, we got chance to create palliative care groups in respective colleges. Already, our online training program team has initiated that activity, and we have completed training for 2 universities, and one university has completely implemented the project. We have many universities, but only 2 universities has taken that initiative in initial days, but all universities are supposed to implement that project, but only the fully implemented that the project has been fully implemented by only by 2 universities, like Kerala University and the Kalam Technological University. That means KTU, that is an engineering department or the university in Kerala. And we have got some requests from some other universities, few universities like Kannur University, Calicut University, to implement this particular project. And Kerala University has completely, they have that particular university situated in 4 districts of Kerala, and they have 169 colleges, and they have implemented this particular project in that 169 colleges. Last year, we have started a day for this, especially for students' activities, or SAPC day we have declared as the October 2nd, we have declared as SAPC day. And last year, we have conducted a big online event, and we have honored or just acknowledge their activities, and every year we will be observing that particular day as a SIPC day. The objectives of that particular the student initiative in model to select student volunteers to fight against needless suffering and pain. The same concept will be we will be identifying 25 core members from that college or institutions. That 25 members will be divided into 5 committees. That 5 committees will be acting in different ways. Like some of them will be concentrating fully on patient care activities. Some of them will be concentrating on the campaigns. Some of the committee will be taking care of the patient adoption, and in different activities they will be involved, and using their talents to wipe out the needless suffering from their locality. Using their talents, time, or expertise, they will be like, for example, one of the leading college in Trivandrum, College of Engineering and Technology Trivandrum, they have initiated a project called D-Care. D-Care means with that D-Care project, they have started some activities like to develop assistive devices for patients in palliative care system. Or like when a person buy a wheelchair, the particular person is not able to use that. Based on their need, they will be customizing that particular wheelchair for their use, or developing different activities. Or if a person is got the spinal cord injury, and after that hospitalization, when the person go back to their home, they won't be able to move around their home, or they will be having some obstacles with a few steps in front of their home. Based on their need, they will be creating some ramps, or they will be modifying the particular toilet used by the beneficiary, and they will be doing some sort of modification to make the patient and their family members more comfortable. And with this, that particular D-Care project, they have done many made changes in many people's life. Then one of the team had conducted a long the cycle ride to create awareness about palliative care from one part of the north part of Kerala to south part of Kerala. They have conducted a cycle ride, and they have covered many parts of Kerala, and through that they have conducted a long campaign for palliative care activities and creates future the objectives. The third objective of the Sunspain or the SAPC activities create future generation with value added life and fully socially connected. Like we are just giving some adding some values in their lives. They are supposed to respect the people, or they are supposed to see the suffering of people, and based on the sometimes they can act sympathetically, sometimes they can act as an empathetic way. When they act empathetically, they can make some changes in the other's life, and this type of values will be adding through these activities. Yeah, they will be conducting campaigns for palliative care. They conduct fundraising activities. They will be conducting awareness program in and around their area. They will be providing all sort of social the social support to the patients in and around their college. Outcomes: the satisfaction of having helped a suffering human being. They will be getting valuable experiences, good backdrop for their career, and they'll be developing some sort of leadership qualities, and they can act or they can work as a group to make changes in the life of different people. Now we can see a small video about how the community is involving in this palliative care activities, or when we see a patient, or when we see a particular beneficiary, how the community is involving in that activity. We can see and compare. Vaishnav, could you please help me to share? Yeah, thank you. Yeah, from that video, I think so you got an idea about how a community is involving these activities, especially when they listen to a particular person in their neighborhood, especially when they listen to the suffering of their fellow beings, how they will be reacting or how they are acting as a support system for that particular family or particular person. Do you want to comment on this video? Otherwise, we'll be going forward.
Any comments? You can unmute from your end and speak.
Shall I continue?
We have a chat coming in, sir.
Yeah, fine.
A good depiction of how the community plays an important role in supporting a person.
Thank you.
Thank you, Telson. I think we can go forward, sir.
Yeah, thank you. Yeah, now we are going to see the different roles performed by the volunteers in the community. Yeah, they will be giving emotional support. The emotional support means they will be promising that the patient is not alone. We will be with you as a community to support you, and we will be make sure your all needs or the fulfilling of your needs. Like that, they will be promising, yeah, you are not alone. The emotional support means they will be listening to the problems of that particular person or particular family. Through that, they will be giving all sort of support. So they will be ensuring that if something happened to some of the people will ask, some of the patient may ask, like, what will happen to my family if I go away from this home or go away from this world? And with the support of the volunteers in the community, we will be giving the assurance we will be with you and we will be with your family always, as a neighbor, as a friend, as a brother, as a sister, like that. Through this way, they will be providing all sort of emotional support, and they will be supporting the basic, or they will be providing basic nursing care. Nursing care means they are not giving, or they are not performing any procedures, they are not doing any that type of clinical activities, but sometimes some of the volunteers are doing that, but the basic nursing care means the basic cleanliness of a patient, their bathing or their cleaning in and around their home or their room, like that. They can support with the regular visit, they can support all these activities of a particular person. Follow up with the professional home care. Like I have already mentioned that the particular community or the community volunteers will be clearly giving an updates on the basic, or updates on the support, or the updates of clinical support which the care providers has given. Like sometimes a patient is having some sort of pain, the team will be providing the pain medications, and if there is any change by having that medication, or if there is any difference in their pain or like that, the clear updations will be given by to the professional home care team by the community volunteers, and they will be linking up with the professional home care. I have already mentioned that the particular trained community volunteers will be identifying the needy people in and around their community, and they will be directing, or they will be connecting with the particular beneficiaries or families with the professional home care team. And the social support to the family, by the way, like as a food, like many of the patients is having, already you have seen the psychosocial support provided by the palliative care team. In that, the food aspects, the monthly base, like monthly food kit ration, or the cooked food, or with the support of different involving of different community people, the community volunteers will be providing all these sort of support system, and they will be providing educational support. Like education support means some of the family members, due to the illness of family members, the children in that particular family may ignore, or they may lose concentration, and the particular community volunteers will be supporting the education of that particular beneficiary's son, or beneficiaries, or the beneficiary's grandson's education, with the, like the financial support, the career guidance, and they will be continuously mentoring the activities of the educational activities of that particular student in that family. They will be doing continuous like the conversation with the school teachers, their class teachers, and the family members, and the each volunteers, or each students will be getting a mentor from our side. A student will be getting a community volunteers as a mentor for their education activities, and they will be getting all, while opening the school, they'll be getting all sort of educational materials from the community volunteers. And already I have mentioned the patients sometimes need the transportation facility for different consultations or different hospital needs. The particular volunteer group will be taking care of that, or by using their own cars, or by using their own, the community volunteers may purchase a vehicle, or may get a donated vehicle. By that donated vehicle will be used for these transportation facilities in different purpose. The community volunteers will be linking the particular beneficiaries or families in like the support group in and around their family, like the benefactors, sometimes the benefactors, or the different groups which can support the needs of that particular family or the beneficiary by the way of food or by the way of the financial support or different concerns. Then the community volunteers will be providing all sort of rehabilitations. Already you have seen that the rehabilitation provided by the palliative care team is in three ways, like the physical rehabilitation will be there, the vocational rehabilitation will be there, then the food and education rehabilitation will be there. Like that, we will be providing different rehabilitation facilities, especially the vocational rehabilitation facilities. The vocational rehabilitation facility has its own objectives. Mainly, it has two major objectives. One of the major objective is to engage the family members or the beneficiaries to uh, to deviate their wrong thoughts or like that. Then second objective of that particular vocational rehabilitation is to give some sort of financial like sustainability for that particular family, of financial support to that particular family. The volunteers will be taking all the products made by the patients or their caregivers, and they will be the like guiding for marketing and all the things. And the particular volunteers in Kerala, they have taken a oath like they won't give any memento or the pannada for honoring any people while they conduct any program, but they will be giving the vocational rehabilitation product made by the volunteer or the beneficiaries for these activities. And through that, these ways, the community volunteers are involving in the rehabilitation activities, or they will be facilitating government schemes. We know that the government, especially the social justice department of different states, is providing many welfare schemes for welfare pensions or schemes or assistance to different beneficiaries about the like sometimes the caregiver is getting some sort of pension for doing caregiving, or the disability pension or the cancer pension. All these facilities are there, but if the beneficiaries or family members is not aware about that, what is the use of that? Then the particular community volunteers will be make sure that if they are eligible for, if they identify yeah, the particular family or beneficiary is eligible for that particular scheme, they'll be facilitating and they will be connecting with the other systems to get that particular scheme. And also they will be conducting regular awareness in the community. Whenever and wherever they got some chance to speak about palliative care, they'll be definitely utilizing that chance or the opportunity. When they travel, they will keep some sort of pamphlets or some sort of brochures to give some sort of awareness to the other people. And the regular awareness program is one of the major or one of the main activity of the community volunteers. And sometimes they may give training for the family members in different aspects. Like I have already told that we will be providing, the community volunteers will be providing the basic nursing care, but some sort of retired nurses or retired health inspectors will be available with as a volunteer. We can give, or we can ask them to provide other sort of training or the basic care training for the family members. Then they will be assisting in all the administrative activities, like they will be doing some sort of data entry. They will be doing some sort of taking some sort of classes for many activities. They will be involving in different administrative activities in an sometimes the volunteers are closely associated with the particular care providing organization, or they will be doing some sort of administrative activities in their area or in their society itself. then they will be conducting resource mobilization. Especially our volunteers are conducting different fundraising activities. Like, for example, they'll be doing some sort of food festival or 3 to 4 days activities to raise fund for patient care activities or patients' children's education, or to provide some sort of vocational rehabilitations. Or sometimes they will be conducting some sort of art exhibitions or painting exhibitions by collecting all the support system in that community. And through these, they will be raising, or they'll be collecting fund for our patient care activities. They'll be supporting the particular group or particular care providers to give care to the beneficiaries. Like, for example, in schools or colleges, we have implemented a project called Share to Care. Whenever they conduct some sort of activities in their college platform, they'll be putting, or they'll be keeping something for the patient care activities. Or sometimes they may create, whenever they conduct some sort of celebrations in their organizations or the education institutions, they'll be ask the patients to come and exhibit their products, or especially exhibit their rehabilitation products, and make the other participants to purchase from that particular stall, and make some sort of giving some sort of financial stability to the family. And another program we have implemented in, especially with the support of educational institutions, that is called 1 rupee 1 life. Means they will be keeping, they will be reducing their tea, and they will be putting that particular amount in that in a box kept in a particular educational institutions. And at the end of the month, the core committee will be collecting all this amount. Sometimes they may give to the directly to the beneficiaries or to the care providing agencies. And in this way, they will be, the community is involving in different activities and different things. And we need to remember a few things, especially because it is why we are doing all these things, because it is the responsibility of the society to give support to their fellow beings. And most of the people are considering this as a charity, but we need to make sure that this is not a charity, it is our responsibility. And it is the right of the other people to get the service or get the support from our side. The social responsibility of, or like the word social responsibility, if I am speaking to you as a teacher or as a social worker, in my my ability to speak, or if I am before you, or like there are more people involved in my like mentoring, or many people are involving in my activities, especially my family members, my parents, my siblings, my teachers, and I have received a lot of support from my society. I'm supposed to give back that particular support received from the society for the development of others. That is the meaning of social responsibility. And we are just trying to do our duty as part of our social responsibility, and it is not a charity activity. We should have to remember this. It is not a charity, it is our responsibility. We can see one more video about the story of Pasi. What when they get some sort of palliative care services, when the community involved in their activities, what the change, or what sort of change we can see in that particular person's life. Vaishnav? Thank you, Vaishnava. Yeah, we'll be continuing with the presentation. Yeah, you have seen that in that story of Fasi, what sort of changes happen in their life with the involvement of palliative care team, with the active support of volunteers in that community, what sort of changes happen in his life. That means I have limitations. I have my own way of acting, but I have nothing to do. I can give some sort of support, but when I replace with we, even illness can becomes wellness. Through activities of a group or as a team, we can changes or we can make changes in many people's life. That means their illness can change or becomes wellness. We can do that. As a conclusion, what we are doing, not to add days to their life, but to add life to their days by reducing their uncertainties, fulfilling the needs of by the community, by giving promise that you are not alone, we are with you. By this, I just concluding my presentations. If you have any questions about my presentations, you can ask now. And otherwise, I'll be handing over the mic to our Sunanda ma'am to speak about what you can collaborate after having this training program and all the things.
Thank you, Babu sir, for that explanatory session. We can go to Sunanta ma'am, hear from her, and then be part of our discussion.
Thank you, Raju. Yeah, I'm so sorry. Suddenly something happened to my camera, so I'm not able to switch on my video. So please bear with me. And am I audible, Raju? Am I audible?
Yes, ma'am, you are.
Yeah. So hi everybody. Good evening. My name is Sunanda, and I am working in Palliative India as regional coordinator for the Central India. So let me just quickly, go back to what just now Babu sir presented. It's I think for all of us who are here today, it's a kind of menu that has been given to us through Babu sir's presentation that, what we can pick up, according, because I know in this batch we have people, like we have students, and I know we have students, we have professionals, we have people working already in palliative care, so we are from different professional areas and with different expertise, skill sets and backgrounds and different states of India. So now coming back to what I'm supposed to say. So I work for a team called State Facilitation Team, okay, which is in Palliative India, and we have scaled up, and we are trying to reach each part of the country. So it has been divided. So like I'm looking after the Central India. I'll just mention my states now. So it is Maharashtra, MP, Chhattisgarh, Goa, Gujarat, and Orissa. So all those who are here from these states can contact me. Rajesh Lakshmi will share the contact details. Now coming to the other parts, we have one regional coordinator for the North region of India. So his name is Rajendra Bijalwan, and another regional coordinator is in the Northeast. So I can see people from Northeast out here. So you can contact Rontu Sangma. He's looking after the Northeast. And for South, we have Vishnu, who's looking after the Southern region of India. So now the point is, how do we coordinate? So first contact point would be us, like the regional coordinators. So whoever belongs to whichever region, you now know the person's name and contact number, so you can contact. Now coming to what we can do. So a little bit I would like to say that, in my opinion, like volunteers have their own special place and their specific role in palliative care. Like as we always talk about, it's a interdisciplinary team, so volunteer has their own specific role. And if I have to tell in short the role of volunteer, if I'm asked, I'll say that the volunteer can become a bridge between the beneficiary and the services. So it can be anything you can pick up from the slides that have been shown by Babu sir. So we can be the bridge, and I think we all know how important the role of a bridge is. So Now coming to the next point, I can give you some, ideas how we can start. So I can say we can start like, with a small group. Like suppose I'll talk about one of the student. So that person after the session can go and share with his fellow beings or his friends, like saying that, this has helped me and I've come to know these are things. So the sensitization, the awareness starts from right now after you are logging out of this session. So that matters a lot, because people see, this is a, I think, team of 39 we can see. So, and India is such a vast country, so like word of mouth or through conversation over a telephone or over WhatsApp chat, we can spread this. The first minimum thing that we can do, I think so, and I hope all of you will agree with that. So that's one thing. And then those who are already working, so I think their team needs to be trained. So again, when you need training, so Parliament is already doing offline and online. So we can, manage that, how people can be trained. And now coming back to volunteers role, like Raj, Babu sir was saying, we have like places like Rotary clubs, Lions Club, NSS. So we can look for these kind of setups in our, wherever we are staying, and we can start, maybe conducting some awareness sessions or anything. So I would like to know from you if anything specific, someone of you have already thought of, like, because everybody has their own strengths, how one can contribute. Some can give time, some can give knowledge. So that would be great if you can just think of it and get back to us. It's never one way, I have certain things in my mind, and you can contact me and we can discuss and take it forward. So I think this is the way I want we can start with. And anything specifically for Maharashtra, I can see people from Maharashtra and Orissa here. So for Orissa, I think there are organizations who are working, and especially in Bhubaneswar, we have organizations who needs a lot of volunteer for their work to spread out. So you can contact them. And for Maharashtra, from Mumbai, I can see a lot of people. And I think Bhavna ma'am has asked a question about the offline trainings in Mumbai. So for that, Bhavna, you can contact me. We'll discuss how we can, take it forward. And for any kind of other, any kind of thing, like any other queries other than what you have been taught in this 5 days, please contact your original coordinators. We will connect you to the proper professional, like, whoever can be the expert. Am I right, Babu sir?
Yes.
Yeah. So I think with that, I'll just stop and wait for your questions or anything you want to ask me in specific. Thank you so much.
Yeah, if you need any sort of support in Kerala and any part of Kerala, you can contact me or Vishnu for that.
Yeah.
Already Vishnu's contact information has been shared by Rajalakshmi, and if he is not able to do, or if he is not in a position to reach, you can call me. No problem.
Sir, in order to, because palliative care has been existing since 2008, now it is 14 years, almost a decade past, still many people are not aware of the services. So in the palliative care, is there any wings or like media publications where you have drafted some videos or some posters or anything so that we could share with our community members?
Yeah, if you can see or if you can watch, go through our website, you will be getting some videos about palliative care from our website. Already, Raju, will you be able to share the website ID?
Yes, I can share it right.
Fine. You'll be getting that, and we will be publishing a monthly newsletter from our side. We will be getting that newsletter. We'll be adding all these participants with our newsletter reception. Then we'll have some sort of Malayalam magazines published in all over Kerala. That is means the Sakhayatra magazine is a monthly publication to spread about the message of palliative care and other like the stories of stories by the patients or the beneficiaries or stories by the volunteers, like that we will be adding in that particular magazine or particular publication. And that is also one way of spreading the message of palliative care. Then at the end of this sessions, we will be providing or we'll be sharing some learning materials with you, some videos and some other things. Thank you.
Sir, regarding the research work, sir, do you have any research wings, sir, in Pallium India?
Yeah, it is only this training program is only for the introductory section, and based on your interest, we will be connecting you with the different departments. Like we have research and research department with us in our team. You will be getting the contact information from our website about the research and other activities.
Okay, sir. Okay.
Thank you.
Thank you, sir. Thank you, Sunanda. Any other questions or comments?
And from our website, you will be getting the directory of palliative care, and where and in every stage palliative care will be getting, or like that information will be getting from our directory. What sort of support you will be getting, like that.
Truly said, Babu sir. So we have shared that link also. It is termed as clinics. So I've shared that link also.
Yeah, one more thing to add, you'll be getting the details of our helpline services. Yeah, we'll be providing a telehealth facility from our Pallium India headquarters, and that will be providing in 4 to 5 languages, and you will be getting support from that telehealth facility too. And they will be doing the preliminary assessment and all the things through video, chat, and all the things. And after that, they will be directing the particular beneficiaries to in their locality or local centers.
We have a comment from Padmaja ma'am asking for any organization attached other than Cipla Foundation. I think ma'am, you can get contacted with Sunanda. She will help you with.
Yeah, Padmaja ma'am, I'll talk to you after this session. I'll talk to you.
We are getting good comments like informative session. Thank you and all. Thank you all for those kind words. Any other questions you can ask right now? We have got another 10 minutes to wind up.
Yeah. Especially those who are from Kerala or in Trivandrum, those who are from Trivandrum, you can contact us for further support and all the things, and especially from Kerala. And others can contact other contact persons in respect to the region. I think so. You got some information about community involvement in palliative care. And with that, shall we conclude, Raju?
Yes, sir, we can conclude. So whatever Babu sir